A 4-year-old man is brought to the emergency department because of lethargy, confusion, and a fainting episode 2 hours ago. He was alert after he regained consciousness. Over the past 2 months, he has gained more than 10 kgs. He takes no medications. The patient's father has a history of recurrent stomach ulcers despite multiple medications. Laboratory studies show a glucose concentration of 45 mg per deciliter and an increased C-peptide concentration. The hormone most likely causing this patient's symptoms is originally synthesized in which of the following structures? Go ahead and pause the video and try the question yourself before we go into the solution. Before we tackle the solution, it's important that we understand how insulin is synthesized. Pancreatic beta cells contain rough and the pancreatic beta cells are responsible for creating pre-proinsulin in the rough endoplasmic reticulum. And this should make sense because insulin is a peptide hormone and the rough endoplasmic reticulum is lined by ribosomes. The pre-signal is cleaved from pre-proinsulin, creating just proinsulin, which is stored in secretory granules of the pancreatic beta cells. Whenever there is a need for insulin in the body, proinsulin will be cleaved, and there will be exocytosis of insulin and C-peptide from the actual granules of the pancreatic beta cells. So patients who are experiencing insulin-secreting tumors, such as insulinomas, have an elevated insulin and C-peptide. Something to note is that if a patient has excess insulin but no C-peptide, that is a signal that it is exogenous insulin use, because exogenous insulin does not contain C-peptide. Insulin will then upregulate GLUT4 receptors, which are found in adipose and skeletal muscle, in order to bring glucose into those cells. Let's go back to the vignette. So here we have a patient who is here because of lethargy, confusion, and a fainting spell, which is secondary to the hypoglycemia. This patient has an elevated increased C-peptide, which is consistent with an insulinoma, and his history also supports the diagnosis of an insulinoma, as he has gained weight. Insulin causes you to gain weight because it allows glucose to enter the skeletal muscle and adipocytes in order to store energy for later, whenever there is excess glucose in the blood. The father's history of recurrent stomach ulcers, despite multiple medications, is in the vignette to further support the assertion that it'll be an insulinoma, because a disease called multiple endocrine neoplasia, which is inherited in an autosomal dominant fashion, has some instances of pancreatic cancers, such as gastrinomas, which would cause recurrent stomach ulcers, as well as insulinomas. The hormone that is most likely causing this patient's symptoms is most likely synthesized in which of the following structures? The answer is C, the rough endoplasmic reticulum, which is lined by ribosomes. Free ribosomes are responsible for creating proteins that stay inside of the cell. So think all of the enzymes involved in pathways like glycolysis. B, the mitochondria. The mitochondria is responsible for creating ATP, not proteins. Secretory granules. So this is an interesting distractor, but remember that synthesized is different than storage. So even though proinsulin is stored in the secretory granules of the pancreatic beta cell, it's not correct. And the smooth endoplasmic reticulum is involved in steroid synthesis.